Is walking good or bad for Piriformis Syndrome? It's a really good question. The answer is actually pretty straightforward, so it'll be a short video today. But that being said, I want to give you some outside-the-box things to think about as it relates to walking if you have some type of unresolved back, butt, or sciatica problem. Real quick, if you do not know me and or you are new to my channel, my name is Dr. Charlie Johnson. I am a physical therapist. I have my orthopedic board specialty, and I teach people all around the world with back, butt, and sciatic issues how to fix themselves naturally using the power of the mind and movement as medicine. Now, you might be watching this video because you think you have Piriformis Syndrome, but there are lots of causes of a pain in the butt. So what I would do is check out my free DIY diagnostic guide. You can click the link above. There should be a little button there, and or check out the link in the comment or description below. All right, so is walking good or bad if you have Piriformis Syndrome? So the real quick answer is as long as it is pain-free and or there is very little pain, or there are times when you can walk with very little pain, then there's no problem with it. It's not good nor bad. It's all contextual with regards to what you experience when you walk, all right? So if you have no pain, if walking is not a problem, then go ahead and walk. Walk your heart out and have fun doing it. If there is pain when you're walking, but you love walking, I want to give you just maybe a couple quick tips, all right? So first things first, just recognize that you can walk in many different directions. You can walk forward. This is the way most people walk, right? You can walk backwards. You can sidestep to the right, walking being just progression of the body in motion in one direction, we'll call it. You could walk to the right, and then you could kind of sidestep to the left. So forward, backward, sidestep right, sidestep left. So if while you're walking, you experience pain, so let's just say that, I don't know, you walk 100 yards or 50 feet or 10 minutes or whatever it is, and you start to say, that's when I start to notice my symptoms increasing beyond a point that's tolerable or mild. Well, what you would want to do is you'd want to say, all right, well, right now, if you're like most people, you're walking forward, all right? But forwards is starting to bother you. So what I would do, and only do this if you feel safe, is I'd say, hey, could I, between here and, I don't know, the next mailbox or for the next 50 feet or whatever, temporarily, could I turn and could I walk backwards? And in doing so, you would want to ask yourself, does that make me feel same, better, or worse? Because oftentimes what you'll experience is that your pain, as you're walking, it's not too bad, but then it starts to increase. If right here, when the pain is increasing, you can turn around and walk backwards, sometimes you'll be able to get the pain to go back down. It'll reduce the symptoms. So if it does that, then what you could do is every time you start to notice pain, if you still want to get out, enjoy the fresh air, things like that, turn around and walk backwards. And you'll use backwards walking as your medicine, all right? And then you can't walk backwards for forever, so maybe you just insert that backwards walking pill into your walking routine, and then you walk forwards. And if it builds a little bit, again, we don't want to build too much, so I only recommend that walking is something you do if symptoms are very low to just zero, pain-free, non-existent. I wouldn't push through pain, but you might be able to use some of these strategies, again, if you notice pain when you're walking. So you could test walking backwards. Another way to do it is say, hey, well, maybe I can't walk forwards for that long, but I'm going to walk, and when I start to notice symptoms, I'm going to sidestep to the right. So I'd be facing away from the camera, and I'd be sidestepping to the right. All right, and again, you could do that for a certain amount of time or a certain distance. Probably doesn't need to be that long, but again, if your symptoms are increasing when you walk forward, like normal people do, right, in that forward direction, and you start to notice things are increasing, then insert sideways walking and see if you can get that to calm things down. If sideways walking to the right, right sidestepping doesn't reduce symptoms, then why not try walking forward? Okay, I'm getting a little bit of symptoms. Now you can sidestep left, all right? And again, insert that and see what it does. So just some things to think about. There are different ways you can get creative with walking. What you might find, and maybe tune into this, because it's really all about awareness if you can get this idea, you're just becoming aware and mindful of, you know, is walking bad? Is walking good? Well, most people can answer that at a high level. When I walk, Charlie, you know, it either feels good or bad, and people tend to put extreme labels. It's either good or it's bad. It's binary. It's right or it's wrong. But it's probably neither. So again, if walking is good and there's no pain, just do it. No need to do any of these experiments, all right? But if you notice some symptoms when you walk, just recognize that the way that you think to walk, which is why wouldn't you think to walk normally, straightforward, is maybe bad or increases your pain, but could you get creative, and why do you have to walk forward? Who said you had to walk forward? Could you walk backwards? Could you sidestep to the right? Could you sidestep to the left? And you don't have to do that the whole time when you're walking, all right? Some people might think that's a little weird, but who cares what other people think, right? You start walking and insert one of these directions when you notice that your symptoms are increasing to discover, wow, my body tends to like when I go sideways, or my body tends to like when I walk backwards, because this can often take you to the next step. So if you tweak walking a certain way and you find that one feels great, I don't know, right side stepping feels great, happy, all right? These tweaks kind of drop clues. And what I mean by that is if, as you're walking, you find something that feels good, then you can start to say, how could I turn that sideways walking into an exercise? Well, you could just do more sideways walking, and maybe that's something you do throughout the day to kind of use as medicine. Remember, movement is medicine, or can be used as medicine. So then you can not just walk sideways when you start to feel symptoms, because you learn that that shuts off the symptoms, but why not do that multiple times throughout the day? And so that's how you want to start thinking. When you discover a movement or position in your body when you're doing things like walking, or you can apply this to anything, sitting and driving, then you want to ask yourself, how could I take that movement that modifies my symptoms in the positive direction and do it as an exercise, or make it into an exercise, or apply that concept into an exercise? Something to think about. You can also try walking uphill or downhill. Maybe not all walking is bad, but maybe part of your route is bad. So I talked to a woman yesterday inside of my Glute Relief Accelerator program, and she said, walking's no fun, no bueno, Charlie. And I said, well, what are you doing when you're walking? She said, well, I'm walking. I said, well, okay, where are you walking? Better question. And she said, well, I'm walking my dog, and I go up this path, and then there's this flat, like kind of 2-mile loop, and then I come back down it. I said, so all right, so think about it. When you're on that loop, let's just say here's her loop. She starts here and she ends here. This is maybe uphill, all right? So from the side, she goes uphill, and then she's on a flat, and then she goes downhill. So this is downhill, this is uphill, and this is kind of the flat loop, right in the center here. And she said, you know what I noticed? My pain is worse when I'm on the flat, and that's the majority of my walking. That's where I take the dog for a walk. And so what about when you walk on an incline? Or what about if you walk on a decline? She said, now you think about it, I didn't have any problem walking on the incline. And I was walking, I had pain, and then the pain went away when I walked on the decline. And she asked me, what do you think about that? And at the end of the day, I don't really think that much about it. It doesn't mean, we don't have to justify why that makes sense or why it doesn't make sense. It just means that, well, your body likes that and it prefers it for some reason. Now, so I said, hey, could you just go and could you just walk the incline and walk the decline, walk the incline and walk the decline? So if it takes you, 30 minutes to do this whole loop, could you walk incline, walk decline, and do that for, since it feels good, maybe like 15 minutes in the morning and 15 minutes at night. And then if you want to get super ninja, this is getting a little bit away from the main question, but hopefully this is valuable, all right? What you could do is you could bottle up that kind of idea of what part of walking feels good, or if you go back to our little directions, if you find that sideways walking to the right, or backwards walking, or sideways to the left feels good, but forward is kind of yucky, then you could take the thing that feels good, incline, decline walking, sideways walking to the right, or sidestepping to the right, and you could bottle it up. This is my pill bottle. Inside of that, the label would be right sidestep. That's your medication. You just went to your movement pharmacy and found that the right sidestep feels good, yummy. Then you could optimize the dose, the frequency, and the timing of it. So like we talked about earlier in the video, you could use that to mitigate or reduce symptoms while you're walking, but then you could take that same idea and pull that out, extract it out of walking, put it into a pill bottle and say, if it helps me when I'm walking, why don't I just do it frequently throughout the day? Why don't I do it for 1 minute? I'm making this up. You can get creative here. There's no exact science. I'm going to do it 3 times a day and when I'm walking to keep symptoms low. And now timing, right? Because you think about every medication that you take, like physical medication, oral medication, has a dose. You take 500 milligrams 3 times a day, and you take it in morning or night or whatever, all right? And so 1 minute, 3 times a day, we've now used movement as medicine. Movement pill is in there. all right? And the timing, when do you do it? Well, you want to time it such that it makes sense. Like, if you had a headache pill and you knew it would take your headache away, and your headache was worse at 2 p.m., every day you started to get a headache after lunch, when would you take the pill? Would you take it, at 6 a.m.? Would you take it at 7 p.m.? No, you wouldn't. You would take it at maybe 1:45 because you're thinking of it as a medication. You're using it to kind of like prevent, right, that headache from occurring. You take it right when the headache started or just before. So if you have some pattern, you know that at the end of the day your symptoms get worse, or after lunch your symptoms get worse, or right before you go to bed, maybe you're going to have trouble sleeping because your symptoms are going to be worse, or you wake up and the pain is really bad, then why not take this thing, this pill that you just discovered, optimize the dose, the frequency, and then time it accordingly. Do it in the morning, right when you get out of bed if you know that 8:30, 9 a.m. is the worst. Do it right before you go to sleep. Here's the thing, it might not be feasible or it might not be convenient, but this whole pain experience is not convenient. So we've got to do inconvenient things potentially, or inconvenient things, right? And so do the walking right before you go to sleep. Or if symptoms are worse after lunch, maybe because you've been sitting all day at work, or at least that's an idea, right, or a theory you have, then test it. And right after lunch, put one of these walks. And when I say walks, a bunch of side steps. All right, that's when you do a bunch of side steps. All right, or maybe it's not to the right, but maybe it's to the left, or maybe it's backwards. All right, and so hopefully this makes sense. If it doesn't, go back, watch it again, slow me down, because when I get excited, I talk really fast. All right, so these are my daughter's drawings, and so I won't erase them because she'll probably say, Dad, you erased my drawings. All right, so hopefully this was useful, big picture. If walking feels safe, it feels good, go do it. Don't worry about how you're walking, what you're doing fine. You can walk as long as symptoms are non-existent and or very minimum. If walking is a problem, or you notice that I love to walk and I would love, and I want to get back to that, or I want to be able to do that, well, maybe you just can't do it the way that you're used to doing it. And maybe you need to think about different directions of walking, and you can use that as a movement pill while you're walking, and then you can bottle that sucker up, optimize the dose, frequency, and timing, and do it to reduce your pain experience. All right, so hopefully this is useful. Again, this is Dr. Charlie. Let me know your thoughts in the comments. Did you enjoy the ramble? Did you not? Also hit the like button and hit the bell after you subscribe, of course. Hit the bell for notifications when I go live every single week. Thanks so much. Chat soon.